A 28-year-old voice actor used nitrate inhalants for 4 recording sessions. This is what happened to his blood. A male patient, known as LR, presented to the emergency department with a startling blue tint to his lips and fingernails. Despite receiving 100% supplemental oxygen, his pulse oximetry remained stuck at 85%. As his breath grew shallow, the medical team noticed his blood was not bright red but a deep, dark chocolate brown. LR arrived in a state of respiratory distress that seemed to defy the laws of physics. In the sound booth, he had been performing high-intensity vocal takes when he suddenly clutched his throat, gasping for air his lungs could not process. The clinical mystery was the oxygen gap. While his lungs were clear and his intake was high, his tissues were suffocating. Doctors observed his skin turning slate gray, a condition known as cyanosis. The patient was in a state of cyanosis, a physical manifestation where the lack of oxygenated hemoglobin turns the skin a ghostly shade of indigo. This was a blue state that no amount of supplemental oxygen could fix. When paramedics placed a pulse oximetry probe on his finger, the reading bottomed out at exactly 85%, refusing to budge. This was cyanosis, unresponsive to supplemental oxygen, a sign that the crisis was not in the lungs but in the blood itself. When a nurse drew a sample, the syringe filled with a thick, opaque liquid the color of dark chocolate. This appearance suggested LR's internal oxygen delivery system had been chemically altered into a suffocating barrier. To solve the mystery, doctors turned to his partner, who revealed a hidden habit. To endure 4-hour shifts of screaming for a video game role, LR used a vocal hack found online. He was inhaling isobutyl nitrite, sold in small bottles labeled as room odorizer. Isobutyl nitrite acts as a potent vasodilator, forcing the smooth muscles in the blood vessel walls to relax and widen almost instantly. This rapid expansion causes a sudden drop in blood pressure followed by a head rush. While LR used it to relax the smooth muscle in his throat, the chemical forced his blood vessels to open wide. This caused a massive head rush and a dangerous drop in blood pressure. By trying to relax his vocal cords, LR inadvertently initiated a catastrophic chemical reaction within his red blood cells. Under normal conditions, the iron in your hemoglobin exists in a ferrous state, known as Fe2+. In healthy blood, iron remains in the ferrous state, which allows it to bind and release oxygen as it moves through the body. This specific chemical charge is what makes life-sustaining gas exchange possible. This molecular shape allows it to grab oxygen in the lungs and drop it off in the tissues. But isobutyl nitrite is a powerful oxidizing agent. When it entered LR's bloodstream, it stripped an electron from that iron, converting it into the ferric state, or Fe3+. This transformed his hemoglobin into methemoglobin. Hemoglobin is the primary transport protein within our red blood cells, acting like a molecular ferry that carries oxygen from the lungs to every vital organ. Without its integrity, the body effectively suffocates from within. The patient was suffering from methemoglobinemia, a dangerous condition where the iron in his blood had oxidized to a point where it could no longer transport oxygen to his tissues. His blood was effectively broken at a molecular level. Ferric iron cannot bind oxygen. Think of hemoglobin as a delivery truck with 4 seats for oxygen passengers. The nitrite acts like a hijacker who welds the door shut on one seat. Then, a devastating allosteric shift occurs. The remaining healthy hemoglobin molecules underwent an allosteric shift, increasing their affinity for oxygen so much that they refused to release it into the starving tissues. This created a molecular trap that worsened the cellular starvation. This shift increases the oxygen affinity of the remaining ferrous sites. Essentially, the hijacker locks the seat belts on the other 3 passengers so tightly they cannot get out. The truck is full, but the city is starving. With a methemoglobin level of 45%, nearly half of LR's blood was physically refusing to release life-sustaining gas. As oxygen starvation intensified, LR's body prioritized its most expensive real estate. The brain, which consumes 20% of the body's total oxygen, was the first to falter. He entered a state of profound hypoxia, where the vital organs are deprived of the oxygen required to maintain cellular metabolism. This lack of fuel causes the brain and heart to begin failing in minutes. This lack of fuel triggered an altered mental status. LR became combative and confused as his neurons struggled to maintain electrical gradients. Simultaneously, his heart attempted to outrun the deficit with tachycardia. To compensate for the lack of oxygen, his heart rate spiked into severe tachycardia. His pulse climbed north of 140 beats per minute as his body tried desperately to move what little oxygen remained. With no oxygen for aerobic respiration, his cells pivoted to anaerobic metabolism, creating a toxic byproduct. This led to metabolic acidosis, a buildup of lactic acid that soured his internal pH. Amidst this collapse, LR complained of a dark void in his vision. This is pauper maculopathy. Beyond his blood, he developed a toxic maculopathy. The nitrites physically damaged the foveal cones in his eyes, creating a permanent black spot in the center of his vision that no surgery could repair. To save his sight and his life, the medical team had to reverse the chemistry before his heart gave out. The doctor ordered an intravenous drip of methylene blue. This deep-colored dye acts as an electron donor, providing the missing pieces needed to repair the broken iron in the blood. Once inside the red blood cell, the drug is converted into leukomethylene blue, which interacts with an enzyme called NADH methemoglobin reductase. The body normally uses an enzyme called reductase to donate electrons back to the iron atoms, returning them to their functional state. However, the sheer volume of nitrites had completely overwhelmed this natural repair system. This enzyme facilitated a rapid transfer, reducing the ferric iron back to its functional ferrous state. Within minutes, the transformation was visible. LR's slate gray skin flushed with a healthy pink as his hemoglobin finally released its grip on oxygen, allowing his brain and heart to breathe. Post-treatment labs confirmed the victory, with methemoglobin levels dropping below 1%. Before discharge, doctors warned LR that his 4 days of heavy use had created a cumulative toxic load his body could no longer clear. He survived, but the black spot in his vision remains a permanent reminder of the day his blood turned to chocolate. Thank you for watching. LR's case shows how quickly a hidden habit can turn the body's life support system against itself. LR survived, but he carries the permanent scars of his 4 recording sessions in the form of impaired vision. His case serves as a stark warning about the hidden dangers of inhalant abuse and the fragility of our internal chemistry. This is a composite teaching case for curiosity and education, not a transcript from a real chart, and not personal medical advice. See a licensed clinician about your own symptoms or care.